if you want to know that an intervention, say a medication or a device works, you need to have some measure of success. You need to have some measure of stroke recovery. If I may, I would say that trialists often focus on the intervention. They get very excited about their new drug or their new device, and they don't always give as much consideration as they might to how they're going to measure that recovery. And it's a thing we often see, maybe not so much now, but traditionally in the large clinical trial sessions, an effect size wasn't seen, but perhaps they weren't measuring the right outcome. So I and the team in Glasgow have done a lot of work around outcome measures. We've done a lot of work around the modified Rankin Scale, a measure of disability. It's a good measure. It's recommended by the FDA, it's recommended by the EMA, but it is quite a blunt measure. If you want to see subtle changes, modified Rankin isn't going to be enough. More recently, I've been looking at outcome measures around things other than just physical function. And I'm particularly interested in cognitive and mood outcome measures. I'm interested in them academically, but my interest really comes from speaking to stroke survivors. Because when you speak to stroke survivors, they often say, it's not that my leg is weak or that my face is weak that's interfering with my quality of life. It's my low mood, it's my lack of energy, it's my poor concentration. Measuring those constructs is more difficult, but I think we need to be able to do that in a robust, standardised way so we can do trials that can actually look at interventions for these things.